local radio. Current affairs, lively discussion and music with me, Wahid Akhtar. Now, during this pandemic, we've heard some great stories of local community groups, faith organisations and individuals who are going the extra mile to help their communities. And one of those areas has been dealing with misinformation and taking positive action to reach into communities, especially to increase the take-up of the COVID vaccines, particularly with those communities that are at higher risk. And one such example is happening this Thursday with a vaccine hub to be held at a mosque in Sheffield. I'm joined by Dr Gasan Chetty, a GP at Belgrave Medical Practice at Asline Road, and Usmaan Mohamed, who's Secretary of Makki Mosque, based at Plantation Road in the south of Sheffield. Dr Gasan, good evening to you.
Good evening. Hi.
And in February you held a question and answer session, Dr Gasan, on COVID and the vaccines. How did that go?
Very well. We had a fantastic turnout on the Zoom, and it was quite impressive to see representations from various aspects of the community, especially with the BAME community, ethnic Asian community, and very, very encouraging. And from that, it led on to this point in time, where we're having these discussions now with a view to having a vaccination at the local mosque as a hub.
And how will that work then on Thursday, the vaccine hub?
Well, I have met with Usmaan and the Imam, and we discussed it. Basically, it's going to be a drop-in session on Thursday, 11th of March, from 1:30 p.m. But it's a drop-in session for people who are in the eligible groups and who are also patients of the Healing Plus network practices, primarily because we are vaccinating patients who belong to that network, and it's about 8 practices. I don't know if we should go through the list of practices, Wahid.
Yeah, go for it.
So it's Shadow Lane patients who are of Shadow Lane Medical Centre, Veritas, Mackie's Practice, Caulfield, Healy Green, Leadless Medical Centre, Sloan's Medical Centre, and Abbey Lane and Tottley Rise Medical Centre. So if you're patients of these medical centres and you are in the eligible groups, which is listed on the flyer which has gone out to the various mosques and into the public domain, then by all means drop in. If there are people who do not belong to these practices but nonetheless eligible, we won't turn them away. But I think very clear it's not a citywide approach, it's primarily aimed at our network of patients. And we hope to get a very good turnout, and we have also going to be very vigilant and wary about social distancing and managing the people coming through in terms of the crowd, and all that is going to be work in progress.
Well, let's talk to Usmaan then. Usmaan, Secretary of the Makki Mosque. Why did you decide to get involved in this vaccination hub day as a faith organisation?
Hi there, Wahid. First of all, thanks for putting us on the show and listening to our story. At the Mosque we've been quite keen to get involved and do whatever little we can. We started off with obviously promoting, encouraging the BAME community, which had a lot of questions and sort of very cautious about the vaccine. A lot of worries there. We were trying to debunk some of these worries and concerns, which we'd used our main Friday broadcast to highlight the issues and the importance of getting vaccinated. So Imam Osama had done great work in getting the message to the congregation. Likewise, obviously, Dr Gasan and the Mackie's Practice have been very good in assisting us in actually allowing Imam Osama to get vaccinated, and actually had that recorded again to encourage the congregation and actually show firsthand that as a lead.
Yeah, so you made a little video of that and shared it on social media.
Yeah, on our YouTube channel, on our Facebook. And
what sort of feedback did you get about that?
Very good, actually, very positive. A lot of people who actually had elderly parents or grandparents who were avoiding the vaccination and Fortunately, once it seen the local imam, the lead imam having the vaccination, thought, well, actually, there was nothing to worry about. Obviously, a lot of the community holding faith very central and key to them, and trusting what they've said. So yeah, received very well, and across the city we've tried to promote the video and share that across the board.
And have people raised issues, maybe some concerns about the vaccine then with you as Secretary of the Mosque, or with other members of the committee, or with the Imam at the mosque?
Yeah, I mean, my profession, obviously, as a pharmacist as well, so I have my own pharmacy in Atticus Road, and I deal with the community at dawn over there, and it's surprising to see, how many people actually have sort of concerns about the vaccine, whether it's to do with the ingredients and what's in there, whether it's to do with these conspiracy theories, unfortunately. So there's a lot of sort of mixed messages coming from social media platforms which aren't trusted sources. The key message me as a healthcare professional is, and in terms of the mosque management, is go to the right source, rely on the healthcare professionals. If you really want to look up something online, go to the nhs.uk and also the gov.uk. There's a lot of good literature on there if you want to get trusted and evidence-based information.
Dr Gasan, you talked earlier on about the 8 practices in the Healy Primary Care Network, and just looking at how they are distributed across the city, it's quite a diverse area. There's a lot of ethnic and religious backgrounds there. There's some of the quite rich areas in the city. There's some of the poorest areas in the city. So overall, what sort of response have you had to take up within this area, take up the vaccine?
We've had excellent response. I mean, in 2 months since we started, or 2 months looking now as I speak to you, we've vaccinated over 10,500 patients. That's just in our network alone. We've had a very uptake, so clearly with the practices that have a higher proportion of patients who are in the BAME community, we noticed that statistics were not very favorable towards that group of people, whereas, as you quite rightly said, some practices that are more sort of a different group of people, and that uptake has been better. But I have to be fair that I think certainly with the hard work of the Usmaan and Imam and getting the message out there that in the last 2 weeks we've been vaccinating, we've seen quite a visible change in the group of the people that are coming through, and a lot of them were Asian patients and elderly Asian patients coming through, and with the younger children or grandchildren who are clearly more motivated in making sure that they get vaccinated. So, it's something that's working and working well, which is very reassuring.
So turning to the practicalities of your session on Thursday, how will it work then? Do people need to book in advance? You mentioned some categories that people need to be from, that they should preferably be in one of the surgeries, in one of the medical practices involved in the Healy Primary Care Network. What are the things that would they need to do to be eligible on Thursday for a vaccine?
Well, they need to be, as I was mentioning, if you go to gov.uk, NHS UK, and look at the cohorts, and it's usually, it's those in the cohorts 2 to 4, which would be people who are elderly, carers, people working in any care setting, and also people in what we would say cohort 6, which is anyone between the age of 18 to 65 years in an at-risk group. At-risk could be having certain whole host of medical conditions, including over the recent weeks, including in that at-risk is ethnicity. So that has actually increased the at-risk group. So ethnicity is one of it. So deprivation, because we have areas of deprivation within our courts. Homelessness, male seems to be more at risk of severe disease than generally female, but that's not discouraging any female patient, but we're just giving the increase in the overall cohorts in the patients, and severe obesity, body mass index of greater than 40.
And Usmaan, finally, just remind us of the time and venue.
So it's at the Makki Mosque on Plantation Road, and it's a 1:30 start to 4 o'clock. And once the faith is dropping, we will be taking the name and details of the people as they come in, and we will be restricting the flow in groups of probably 10 or 15 at a time. And outside, we will rely on the volunteers, people from the Sheffield and Healy Trust link workers to help with crowd control and reassurance and moving the crowd through as we vaccinate them.
Great stuff. Well, thank you both for joining me on the programme. That's Dr Gasan Chetty from Belgrave Medical Practice and Usmaan Mohamed, Secretary of Makki Mosque based at Plantation Road in Sheffield.
The sound.